Recently, we published a Richter's Transformation Consortium statement through ERIC guidelines in Blood Journal on the management, workup, and clinical trial recommendations for patients with Richter transformation. The reason why we decided to set off on this endeavor was that there were no guidelines or consensus statements available for Richter's transformation, and we thought that by getting all of the experts into a room and coming up with key specific things that we want to state about the future and present of Richter transformation, that hopefully we can make an impact on the survival for patients with Richter's transformation moving forward. So Richter's transformation continues to be the unmet need of patients with CLL, where the overall survival has been described as anywhere between 6 months to 24 months post-diagnosis. And so we need to do better at aligning our research to make sure that we can identify new targets of intervention and also identify what we're currently doing that works. So that way we can use that intervention broadly amongst patients with Richter transformation. So we're hopeful now that we have these consensus statements published that we will have more alignment across academia and also private practices in order to make sure that our patients with Richter's transformation receive the best care moving forward. Now, one of the more interesting aspects of these specific consensus guidelines is the clinical trial recommendations. So I advise anybody who's thinking about creating a clinical trial for patients with Richter's transformation to take a look at that section closely and try to align what you're doing in the clinical trial with what we suggest. So that way, in the future, when we have multiple clinical trials, hopefully for patients with Richter's, we are better able to do cross-trial comparisons, and we're also all aiming to improve survival with patients with Richter's transformation and designing trials that are specifically able to do that, and also designing trials where we're obtaining prospective biobanked samples in order to do better research in the future to help identify further weaknesses in the Richter transformation.